Good afternoon. My name is Peggy Rauman, and today I am going to be providing you with a presentation highlighting the important aspects of our medication management document. This document was created in 2019 in collaboration with the College of Licensed Practical Nurses of Newfoundland and Labrador. The principles and associated sub-principles outlined in this document reflect the expectations for nursing practice related to medication management to decrease risk to the public and promote public protection. The Canadian Patient Safety Institute 2018 defines medication management as client-centered care optimizing safe, effective, and appropriate drug therapy provided in collaboration with clients and their healthcare teams. Medication management is more than performing the technical task of administering a medication, either PO, IM, sub-Q, IV. It is an iterative process that requires the utilization of nursing knowledge, skill, and judgment to ensure safe medication use. To reduce errors and/or adverse events related to medication management, nurses need to reflect on their individual scopes of practice and their standards of practice in all their activities related to medication management. To provide the safest and most appropriate care in medication management practices, as reflective practitioner, nurses consider principles related to the following: education, authorization, competence, collaboration, and client-centered care. Our medication management document uses these principles with a number of sub-principles to help you reflect on your medication management practices. An important consideration in medication management is the determination of the most appropriate nurse to provide the care. As we all know, our healthcare settings, we operate as collaborative teams, and there may be a number of different care providers, licensed practical nurses, registered nurses, nurse practitioners, and other authorized prescribers. So determining the most appropriate care provider requires critical thinking and judgment and a consideration of the client, the environment, and the nurse. So when you think about the client, you're thinking about the complexity of their care, any variability in the client's condition, the predictability of the outcomes of their care. When you think about the environment, you're reflecting on the context of the practice, including the location where the care takes place. Maybe you're in a rural and remote setting, or maybe you're in a busy acute care center. The availability of and access to resources, including support for nurses, which could be nursing policies and procedures, medical directives, or protocols that are used to guide your decision making. And then you think about the nurse. You're really thinking about your individual skill and ability, your education, your proficiency, experience, and expertise. The nurse needs to be able to manage the outcomes, expected and unexpected, and you have to have the ability to utilize necessary supports. So it is also important for nurses to recognize that the client, the environment, and the nurse are interrelated and cannot be considered individually or in isolation. Our first principle is education. The principle is that nurses practice using evidence-informed knowledge, skill, and judgment. During educational preparation, nurses attain the entry to practice competencies required for safe, competent, compassionate, and ethical care. Throughout their career, nurses build on their foundational knowledge through continuing competency, which promotes good nursing practice and assists in preventing poor practice and contributes to the quality of nursing practice and the best possible client outcome. Competence is acquired and maintained through lifelong learning and the integration of learning into your nursing practice. So there's 3 sub-principles here on this slide. Nurses participate in medication reconciliation in collaboration with the client, family, and healthcare team. And MedRec is a systematic and comprehensive review of all medications a client is taking to ensure that the medications being added, changed, or discontinued are assessed and documented in the best interest of the client. Nurses utilize best practices in medication preparation. That might be crushing or mixing. An example of best practice is not to pre-pour. Best practice states that nurses must not pre-pour medications in advance of a scheduled time because in doing so, they cannot be accurately compared to the medication administration record at the time of administration, and it can blur accountability for ensuring the rights of medication administration and increases the possibility of medication errors. And then nurses follow the rights for medication administration. So the rights of medication administration are just a series of systematic checks. And they may be any number, and they may be specific to your practice setting, but they can include proper patient identification, allergies, medications, and along with the right route, the right dose, the right time, the right education, the right client. Under education, we have two more sub-principles. So nurses transcribe medications, orders to maximize therapeutic effects, support client choice, and comply with agency employer policy. And nurses utilize best practices in safe handling, storage, and disposal of medications. So with your transcription of medication orders, it could be the most appropriate time for best therapeutic outcomes. You could include stop dates or co-signing requirements. And with best practices in handling and storage, that could be something for like cytotoxic medications or disposal of unused portions of medications or wastage. Under authorization, that's our number 2, the principle is that nurses know the medication management practices that they are authorized to complete. So authorization for nursing practice is granted through legislation, regulation, and policy. Nurses must know their individual scopes of practice, their agency employer policies, and the legislation that influences their practice. Legislation defines who is authorized to prescribe medications, and authorized prescribers are required to check the current medication profile. Nurses must know their role in the verification of medication prescriptions for the order entry system that they are using in their areas. So nurses accept medication prescriptions that are clear, accurate, and complete. So resume medications post-discharge, for example, is not a complete and accurate medication prescription. Nurses consult with the authorized prescriber or pharmacy if prescriptions are unclear or require clarification, and that's in the interest of client safety. So if they're unclear or they're contrary to safety standards or they're being used for off-label use, then we would definitely clarify with the authorized prescriber or pharmacy. Nurses only accept verbal medication prescriptions in urgent, emergent, or exceptional situations, such as like where the delaying of the medication would cause risk for the client or cause harm. If you are using virtual technologies or virtual nursing practices, then this is something that might need to be in your employer policy. And nurses comply with federal and provincial legislative requirements in medication management. So some example of federal and provincial legislation is the Food and Drug Act, 1985. And that does not identify nurses as one of the professionals who are authorized to distribute sample medications to clients, even under the direction of a physician. Nurse practitioners in Newfoundland and Labrador, who have the individual competence to do so, are permitted to accept and distribute drug samples under certain conditions, and under certain conditions they may also distribute certain low-risk non-prescription drugs and natural health products as samples. Another one is dispensing. A piece of legislation is the Pharmacy Act 2012, which identifies dispensing as a practice of pharmacy. And if nurses are to dispense, we have a document called Dispensing by Registered Nurses Employed within the Regional Health Authorities that you can refer to for more information on dispensing. Nurses need to refer to agency employer policy and their regulatory body for direction regarding dispensing medications. Other pieces of legislation could be on cannabis, on immunization, or FIA for privacy and confidentiality as some examples. Competence. Nurses are responsible and accountable to practice medication management competently. Competence is defined as having the integrated knowledge, skills, attitude, and judgment required to safely and effectively practice nursing. Competence reflects a level of critical thinking, knowledge, and judgment involved in nursing interventions, as well as the ability to manage the outcomes of those interventions, including medication management. So nurses use their knowledge, skills, and judgment when determining their involvement and the involvement of others in medication management. So you would involve others if you're following up with the authorized prescriber, other members of the healthcare team or pharmacy. You would, if you're involved when involving the client or the family in self-administration, you would evaluate the effectiveness of self-administration. And nurses use their knowledge, skills, and judgment when implementing pre-printed order sets and/or medical directives. And we do have a document on medical directives and pre-print order sets to provide you some more direction on this. Collaboration. Nurses collaborate with the client, the family, and other members of the healthcare team when planning for, implementing, and evaluating medication management. Collaboration is intended to build consensus and work together on common goals, processes, and outcomes. Nurses collaborate as well as communicate and consult with the family, the client, unregulated care providers, and other members of the healthcare team. And this process is integrated throughout all aspects of medication management. So nurses involve clients and family in the management of their medications. So if a client or family member refuses, then you would document the reason for that refusal and then work with them to see what can be resolved. And we do have a documentation principles document that will help you determine your regulatory expectations for documentation. And that's available on our website as well. Client-centered care. Our principle is that nurses practice medication management in a way that promotes and supports client-centered care. And although this is principle number 5, it really stems from, are you the most appropriate care provider? Because you're thinking about the client, the context, and yourself. And you're really thinking about, is what I'm doing in the best interest of my client? So nurses practice medication management in accordance with their code of ethics. Client-centered care includes an approach to nursing care in which clients are viewed holistically, placing the client and their significant others at the center of care, using their needs and wishes to help inform the healthcare plan. And some of client-centered care practices are the right for informed decision-making, ensuring informed consent, ensuring cultural sensitivity, and so on, with compliance with your codes of ethics. We do have an Appendix A, a medication management reflective algorithm. Along the top of the algorithm is the main principles: education, authorization, competence, collaboration, and client-centered care. So under each of these top principles, there are some reflective questions for you. You can use this in any way, but if you don't have the necessary education, then you need to get the education. If you don't have the necessary authorization, then you need to get the authorization. The same with competence. You need to have someone to collaborate with, and you need to do things in the best interest of your client. So these are just some things that if you're having some reflective questions that if you are unsure about your involvement in medication management, they can help you determine what you need to do so that you can be involved in medication management safely and competently. There are additional resources on the CRNNL website, including your scope of practice document, which will help you reflect on what you're educated, authorized, and competent to perform. Like I mentioned, we have a documentations principle document to help you with your documentation guidelines, and we have a dispensing document, and we have a document on medical directives and pre-printed order sets. So we have lots of resources to help you meet your regulatory expectations for best practices in your medication management. But outside of the college, there are lots of additional resources that you can look up and use for best practice and evidence-informed practice in medication management. And that includes Accreditation Canada. the Canadian Patient Safety Institute. You can look at your food and drug regulations. The Canadian Agency for Drugs and Technology and Health, NELCHI, the Newfoundland Labrador Center for Health Information, your Controlled Drugs and Substances Act. You can consult with the Canadian Nurses Protective Society, and there's the Canada Vigilance Program. So that was just a brief overview of some of the main points of our medication management document and how to use it effectively in your everyday practice. If you have any questions, I'll be happy to answer them. If not, you can always reach out to one of the nursing consultants for policy and practice here at the college, either by email or by telephone. We are always available to help you with your practice-related questions. Thank you for your attention.